Hello everyone, and welcome to this audio podcast as part of this pathology edition. This audio podcast as part of the Type 4 squad and part of an audio podcast as part of a Ty4Phoon Twixzter. This is an audio podcast as part of another Storm Robotics production. So in this audio podcast, there will be an overview in line to the aims and the objectives, an overview in around the literature, some of the literature looking at retrospective and peer review works from 2020, and looking at healthcare scientists in primary care. So, in around the aims and objectives, so conducting and carrying out a systematic review over 18 years. 18 years. The aims and objectives are here were to describe how healthcare service users currently receive sort of educational support, and highlight what support pathway in around a particular disease could look like with healthcare with a with a with laboratory specialists and scientists involved, and specifically in regards to sort of base in around in regards to laboratory, looking at laboratory parameters, laboratory tests and investigations. And so this work, as part of the aims and objectives, this work looks to seek to understand if healthcare service users in context of chronic kidney disease or CKD could attain more informed education or understanding or basis on a basis in around disease, through 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 particular cohort of healthcare professionals. And this work would seek to make a few recommendations, and outline if scientists or laboratory specialists should be involved or could be involved to support in around primary care, in around primary care. So, in around some of the literature, there will be an audio podcast that looks into or delve into the methodology aspects pertaining to this systematic review from peer review works in 2020. This audio podcast now will sort of delve into some aspects, some overview in around the literature, in around the literature. So, works from a works from yeah works from author Nankaro and team, um, uh, carried out an investigation, where the objective was to describe varying sort of bases in around an existing workforce, and diversification, specialization, and looking at the implications of changes in around the workforce. This particular works by Nankaro and team. There was no there was no particular sort of sample as part of the work. As part of the work, Lancaro and team have focused their work mainly on carrying out on carrying a literature search or literature review. And the main some of the main findings some of the main findings included the past century. In the past century, there's been a growth and transformation of existing professions, and the introduction of of sort of new workers, and the changes are believed to be the result of developments in certain in developments in around tech, evidence, and new systems of new sys- and in around new systems, some new systems, and organizing and regulating the workforce. And some particular comments, some particular sort of comments in around Nankaro's work, Nankaro and team's works, include specific health professions. Specific health professions are likely to maintain are likely to have a basis in around the main in the main sort of divisions around the particular areas of the work of the healthcare workforce, if they can if they if healthcare professionals amongst varying divisions in around healthcare can diversify to deliver new sort of roles to or new roles, or to maintain ownership in around aspects that are required in and amongst aspects around healthcare or healthcare service. And the groups most at risk with a period of overall workforce boundary changes are likely to be the most likely to be the most specialized. And during periods of high demand for services, the specialists tend to let go of the of less sort of technical or less less sort of less sort of prestigious sort of based sort of tasks, in around sort of in context of disease, or in context of healthcare aspects and disease. There is a sort of a basis in around a monopoly game that's played, and so healthcare scientists or scientists generally as part of the works by Nankaro and team sort of retrospectively, where they where scientists where healthcare professionals or service providers, such as for example scientists, need to be able to sort of offer opportunities, um, uh, and see to offer opportunity to service users, in particular and specifically or particularly in around looking at disease trends, and where disease trends are linked into aspects that pertain to sort of aspects around tech, some aspects around tech, but also in around, for example, in around, for example, biostatistics, informatics, and also in around sort of on the use of sort of online platforms, more online platforms, sort of generally where varying healthcare professionals or service providers have been involved and sort of utilizing. And in around the integrity and the relevance of this particular paper, this particular paper is generally authors highlight the dynamic role and boundaries the dynamic role and boundaries and also where the professions appear to be safe if they can retain high level of demand for specialist services, and if they can retain sufficient control over overalls or compete with existing service providers based on cost, quality, and novelty in around delivery of healthcare services. And another paper, another sort of another works in other works, and this time looking at works from an Australian investigation, a team where Smith and team, where the team looked at implementing a sort of mixed methodology triangulated research approach, and where three academic institutions, 2 health departments, and 2 indigenous organizations corroborated or collaborated to identify workforce capacity in remote communities through a sort of educational basis. In this works by Smith and team, there was 76 semi-structured interviews took place. 35 surveys were implemented. 35 surveys of remote staff, healthcare professionals across Australia, and literature searches literature search was part of the had been part of the findings or the investigations, and 11 100 and just over 111 participants were involved and in around the main findings, a need was found was identified to identified to in this works, where in around the chronic disease model, there was a requirement for those with those healthcare professionals to provide education to those who also provide education, thus to ensure that there was a population health approach. And the training needs analysis identified very little difference between the education and sort of training needs across rural and remote health disciplines or specialties, and it was perceived that they managed chronic disease that they managed the chronic disease quite well, and found that prevention and early detection to be at the sort of hard end in around some of the findings of this works. And in around some additional comments, the main barriers identified were the demands of acute care over chronic over chronic disease, compounded by high workforce turnover in sort of remote areas, and in around sort of the integrity and the relevance in around this works. This works, and what well, whilst it was always it is important to have more research being undertaken in this important area of in around chronic disease model. The authors Smith and team from this investigation informed that there needs to be more there should be more practical ways to alter the acute disease based practice model that dominates in the health workforce towards an integrated systematic population based approach. And the investigation informally highlights that sort of scientists have that scientists have a basis are important have a basis in around as the healthcare and part of the healthcare workforce. Another finding in around the literature was work by Claridis and team, and this work was a Canadian investigation, and the investigation upon methodology involved a qualitative research approach, and to learn what educators across across health professionals involved in around primary health care and around primary health care think about sort of interprofessional collaborations, and the in around the sample around this 36 participants from nursing, pharmacy, speech, language, pathology, occupational 36 participants from nursing, pharmacy, speech, language, pathology, occupational, and physical therapy, social work, and family medicines were involved, and participants were invited to join focus groups of between 6 to 8 health professionals, and themes derived from qualitative analysis. Following as part of qualitative analysis, qualitative analysis involved a grounded theory approach, and one of the main findings was one of the challenges of interprofessional collaboration is in ensuring a transparency and definitions of service providers roles and expectations regarding shared care. And in around some of the comments, defining roles and responsibilities should advance the positive elements of collaborative interprofessional care, and reducing misunderstandings regarding sort of procedures, responsibilities, and authorities. And in around sort of the integrity and relevance of this works, the peer review works in this from this Canadian study by Clarity and team, Claridis and team was highlighted that collaborative patient-centered practice is designed or should be designed to promote the active participation of each discipline or specialty in around patient care or service user in around service users, and it enhances patient and family-centered sort of goals and values, and provides mechanisms for continuous communication amongst service providers and optimizes participants' participation in around clinical decision making within and across disciplines, and fosters respect for disciplinary contributions from all health professionals. In around another investigation. Another investigation, a team at Carvello, and where the team carry out narrative review, and the author relates the author of the work of the peer review works relates sort of understanding of how scientists can be expanded expanded in sort of complex and in around complex and in around a complex and a precarious world, introducing the idea of modern biomedical scientists and scholar, and scholar and philosopher and statesman, for the scientific community, and in around human rights, around human rights, as part of this work by Carvello. The peer review works. There was no sample. It was primarily a narrative. It was an education peer review works, and as part of the main findings, the Carvello in their works inform that scientists or the particular healthcare professionals, health professional cohorts must look to support sort of initiatives concerning global health policy, health policy, and support colleagues who are actively sort of interplay into propagating where there are general concerns, where there are concerns or where there are societal issues and concerns. And Carvalho also highlights, as part of some additional sort of comments, that scientists or particular healthcare professionals, or health professional cohorts will not only tend to collaborate with each other, but could look to collaborate with colleagues amongst the front line. For example, physicians, government officials, human rights and relief workers, who are also looking, or also have been seeking to drive change. And in around the integrity and around the significance of this particular peer review works, in around Carvello's works, the some particular specific questions in around this include: what is the role of a scientist in all of the in generalities, in context of generalities, and how is the scientist to collaborate with other professionals working to combat global issues, and how does the scientist sort of have interplay in around aspects around global health, and also in around productive in around productively, as well as being productively productively involved, and having impact, and having having an impact as well. And another peer reviewed works looks at another peer review works looks at looks at another peer review works by yes by Shaw is by Shaw and team from where this works where this team where this works was from a UK investigation, a UK study where they implemented a mixed methodology approach, and the works sought to explore and examine the work of commissioning care for those suffering with particular diseases, and the factors inhibiting or facilitating commissioners making service change. And in around the sort of sample aspects, um, this team looked at a multi-site where it was a multi-site mixed methodology case study works combining qualitative analysis of interviews, documents and observation of meetings and primary care, and where this particular peer review works highlight had informed that primary care trusts, trust managers, clinicians, general practice based commissioners, and National Health Service Trust and Foundation Trust senior managers and clinicians, and the voluntary sector and local governments, and local government representatives were part of the part of the sample size in works by Shaw and team in this UK in a UK investigation. And as part of the sort of main one of the main findings was that commissioning for long-term conditions around some of the long-term condition or disease disease cohorts, in around the long-term conditions of disease cohorts, commissioning services challenges commissioning services challenges the convention can challenge the have been documented to challenge sort of certain conventional distinctions between providers and in around commissioning, with a significant amount of work to review and redesign services undertaken in partnership with service providers. In around particular specific comments, informative. The works by Shaw and team in this UK investigation was informative. However, did not recognise or factor in sort of the chronic kidney disease, chronic disease model in context of kidney care as a condition. And the research suggests that at least for long-term condition services, decision makers need to think differently about the way in which commissioning is carried out, and about the operation in context of the healthcare market, and in context or in around sort of the in around integrity and the relevance. The research does not include analysis of costs or associated with commissioning work, but had revealed it to be an area of deserving of closer examination or investigation prospectively, and it would be advantageous to underline if there is a value, or if there is a basis of value where service users have access have access to healthcare professionals or allied healthcare professionals, for example, healthcare scientists or scientists in context of primary care, to support clinical or diagnoses and especially wherein primary care physicians or primary care in around where primary care physicians and nurses have incongruities relating and regarding to particular terminologies. So in the peer review works, there is there is a there is an ex, there is a sort of a an overview of the literature, looking at the different literature, and online, as part of online or on social media as part of this audio podcast. There will be a citation or reference in regard to this peer reviewed works, and so this audio podcast will now draw to a close, and the next audio podcast in this, as part of this series, will delve into the sort of methodology aspects of this peer reviewed works, and looking at sort of the methodology and the approach to documenting this works. So that draws this audio podcast to a close. This has been an audio podcast as part of the Pathology edition. This has been an audio podcast as part of a Ty4Phoon Twixzter, an audio podcast as part of a the Type 4 squad, and this is an audio podcast as part of another Storm Robotics production.